Welcome to Dr. G at the Heart of Healthcare. I am here back fresh from Hospice Action Week with my guest here, Kevin Tutunijan. And he is the owner operator of In the Arms of Grace Hospice. And he was my partner in crime as we walked on the Hill in Washington, D.C. with NHPCO and the Hospice Action Network to help hospice, to advocate. So,
That's
welcome to the
right.
show.
Thank you. It's so good to see you finally
Oh my
back
gosh. Have your
after 24 hours traveling. We've been quite the travelers for the last few weeks, haven't we?
Yeah, have your feet recovered. Let's start there.
Partially. Partially. I'm in sneakers today. How are yours doing?
I wore my little foam shoes. I looked at the steps I got on that day. It was
I haven't
12,000 steps.
I haven't tracked my steps yet, but I'm sure I got a good amount in. So yeah.
Oh, but it was so worth it. It was so worth it, everyone. And I'll get into that. But I let me just set you up first because I think we're gonna
Sure.
have fun today. I met Kevin in real life at the City of Hope Interdisciplinary End of Life Symposium. And he walked over to the book signing table and said, I think we're going to be in Washington together. And I was like, oh, I was nervous. I
Yeah.
was nervous.
You were nervous. Yeah, I remember that because just to set it up again, last year, Sheila Clark and Sheila is the president and CEO of the California Hospice and Palliative Care Association. And last year, her and I were, when we did Advocacy Week, we had the whole state together pretty much. It was just the two of us. We had like 12 meetings or something crazy like that. And so we're like, we should have some more advocates with us. And Stephanie, who runs the Hospice Action Network, is kind of our leader there. She was like, we got someone from you guys. She's from LA. I'm like, cool. Who is she? And so when I saw the name, I was like, going up to her.
LA. Wait, let me do my LA sign. They know. So no, it was so great. And being in that, I've done advocacy week with the American College of Physicians, but we were virtual, at
Mhm.
2021 time. So actually being there face to face in the offices on the historic grounds of our nation's capital, I mean, you brought a great comfort because you've done this before and you led the team, but we had 7 meetings and we were able to bring all of these topics to the table that we'll get into. But let me finish setting you up because
For
you're
sure.
amazing. First of all, the title of this podcast today is Humanizing Hospice Ownership in California. And you guys know I have to represent for my state. We kind of have a bad rap in the hospice world. And so you all know that I believe hospice is the heart of healthcare. And, I've been trying to teach you how to find a quality hospice. And Kevin here, he actually has one in LA. And so that's why he was the perfect guest for this topic. So, In the Arms of Grace Hospice was founded in 2011. He's the administrator. It's like a family business, and they're doing great care here. Brand new website will be up soon. And so I really, really, want to highlight things like that. So tell us how you got into hospice. You shared a little bit about a family story with us.
Yeah. So, well, first of all, hospice is a calling, right?
Hmm.
And we
Hmm.
all have our stories, and we all have different experiences of what called us to this to this life and journey and practice. Mine was a personal one. My grandmother was diagnosed with dementia later in life, and my grandmother was a very independent woman, very ahead of her time, sophisticated lady who traveled the world. Lost my grandfather at a relatively younger age, and so she was just always this fiercely kind of independent woman. And seeing the changes towards the end of her life in her final chapter was very jarring for our family. We don't come from a healthcare background. We really didn't know how to navigate this whole complex industry. We were also in denial in the beginning stages of what was going on with grandma. None of us knew. And it wasn't until a few experiences with her that was very like, okay, we got to get this together. And seeing that journey was really the impetus and the inspiration for us to make that transition into healthcare. This is a family operation. We all brought some different elements to it, from my sibling, my sister, to my parent. We all kind of had different experiences and collectively came here. And the most interestingly kind of serendipitous thing about all of this is my grandmother, actually, she passed away the night before my first Joint Commission Triennial Survey. And it's the weird, it was like this full circle experience. Our surveyor came, she's asking all of us, one of the first questions, the introductory questions, like, how did you get into hospice? What brings you here? And we're telling the story. And by the end of it, like, we're all in tears. I'm in tears. My sister, our director of nursing, it was just this like strange, odd, all serendipitous experience, like full circle moment, And almost 10 years later, I had the fortune to care for my other grandmother in hospice care with our organization. So another kind of full circle serendipitous moment where I founded it for one, and after all these years was able to care for the other. So yeah.
That's special. Thank you for sharing that. And those are the stories that keep us going, everyone. Hospice is a calling. Those of us who work in the industry, we know it's great care. We have the Medicare hospice benefit here in the United States. And so we want to do everything we can to maintain it and to educate people about it, and so they can navigate the healthcare system like you did, and like all of us, we help people do that with this podcast. So thank you for sharing that again. So let's jump into some of the things that we talked about on the Hill, because we had 7 meetings. And you all know, here I don't actually shy away from anything, but the business side of hospice, the things that are going on. But I want to focus on the good,
Yeah.
because there are a lot of great things happening. And so we had some talking points and some things that we were advocating for with the NHPCO, the National Hospice and Palliative Care Organization, which is the first and largest membership organization for providers and professionals who care for folks on hospice and palliative care. And so let's see. Some of our talking points where we talked about hospice payment. I'll just set them all up.
Sure.
And we talked about President Carter and hospice. He's been on there for over a year, so we helped educate folks about, the recertification and all that type of thing, and the cost savings. We talked about program integrity and hospice special focus program. Again, that gets on the California love side. We talked about telehealth capabilities, how we're able to do video visits to get the face-to-face visits done, and how that opens access to people in rural areas, but also some of our urban areas. We had a colleague from New York.
Yeah.
Yeah, we have a colleague in New York who's taking the subway to do visits. I cannot imagine how I could get the visits done that way. And then we talked about hospice and palliative care workforce. We asked for support for PACHITA, that's the Palliative Care and Hospice Education and Training Act, so that we can have clinicians when you're in the hospital, when you're getting all these tests and all these workups, so they can talk to you about healthcare at the end of life. And so you're not, what did someone say? Crash in the hospice at the end. We don't want that. We want things to be a smooth continuum. And then we talked about our veterans. We honor veterans. We combined with them, and Gerald's Law came up, and there was a discrepancy in a veteran passing away in a veterans facility versus passing away at home on hospice, and then being able to get their full benefits. And so we talked about that. And then there was also in there, some of the other folks who have done that, talking about pediatric palliative and hospice care. I know that the adult hospices shy away from that, so I'm going to do a whole episode on that soon.
Yeah.
But yeah, let's just talk about some of the things that you led us in when we got those 1,200 steps.
No, I think we did more than 1,200 steps.
Wait, 12,000 steps.
I don't know, but sorry, it was definitely
12,
more than
12,000 steps. I'm going to pull it up right now while you talk about these things. So yeah, so what are some of those topics that really near and dear to you?
We were there representing the NHPCO, the National Hospice Palliative Care Organization, as you stated, and we had advocates from cross disciplines across the country show up in Washington, D.C. It's an annual Hill Day that we do, where we kind of represent hospice and palliative care providers, but also beneficiaries and families and everyday Americans, to the United States Congress, to our legislators, members of the House of Representatives and members of the Senate. And we discuss candidly various legislative priorities that are pressing and pertinent to our members as an organization and just to Medicare beneficiaries. So I am a hospice ambassador with the Hospice Action Network representing Southern California. So I kind of led the Southern California cohort. And this year, chief among our priorities was, first, we kind of touched up on program integrity, which is really important. And I think we'll kind of spend more time about that later. So I'm not trying to brush it off, but I know we'll kind of get into the weeds later. But among the other things were Gerald's Law for the veterans. As you were saying, there is a odd discrepancy among currently as it stands for veterans who choose to die at home, which increasingly the majority of veterans who are dying in hospice are dying at home, as opposed to in a VA facility, where if a veteran dies in a VA facility, they are afforded various burial benefits that they do not if they pass away at home. And it just seems like one of those odd ones. And there were some of the legislative directors of some of the offices were very candid about
very candid
words. Like that's a bunch of, Mm-hmm. So I'm happy to say, at least on that front, I think there was, a lot of support for that end. One of the other big asks was telehealth flexibilities, particularly for the face-to-face recertification. The face-to-face recertification is a regulatory requirement that requires patients in hospice care after their initial 180 days, 6 months of service to receive a certification, face-to-face evaluation by a physician, nurse practitioner, or a PA. And that encounter is fairly low touch in that it's administrative in nature, and Dr. G is going to get upset with me because yes, you can do much more than just it's not administrative when you have a doctor there kind of caring and guiding you and holding your hand. But from a technical perspective, regulatory language, it's more of it's called an administrative requirement. And there are certain efficiencies that we can build into this benefit. It's so that it allows more flexibility, allows for greater access to care. So certain elements of it like this, it seems like a no-brainer that we should have doctors be allowed to conduct these visits over a telecommunication platform, as opposed to, going all over town. We have staffing shortages across the country. But again, that's only one part of the argument, and streamlining the process is another. But more so, again, it's to just fulfill that administrative requirement to give hospices that flexibility to be able to be more efficient.
Mm-hmm, mm-hmm. And to clarify, the face-to-face visit for the recert has to be done by a physician or MP. The PA can only do symptom visits unless something was updated.
You're right.
Yeah. So, so hopefully that's a no-brainer for them so that we can keep the access. Our thing is we want you to know what hospice is and what we do. So that Pachita one was really, really a good one. And they kept saying like that got folded into something else. I didn't really quite get
So,
what that
so
means.
PACHITA's kind of been around for a few years. So it's not uncommon oftentimes for certain bills to like come back with every new Congress with a new congressional year. And I think PACHITA has passed the House twice. It's in the Senate right now. And it's really a bill to amend the Public Health Service Act to give greater access to palliative education across disciplines. So one of the important things, or one of the unique things about hospice care, is that we are a multidisciplinary form of healthcare, right? And we call ourselves the interdisciplinary team. So it is imperative for every member of that discipline to have knowledge and to be educated and to have a background in palliative care. And so training our healthcare providers in this area is of paramount importance. Why is it of paramount? Because healthcare is not just about the beginning of life. It's about the beginning, the middle, and the end. And we need to give equal weight to educating our healthcare practitioners for the end as much as the beginning and the middle.
Mm-hmm.
I mean, don't you think you're the physician here, right? Don't you think that's such an important thing?
Yeah, that, someone had a meme. I'm really involved and engaged in social media, and there was a meme that says the end of life deserves just as much care as the beginning of life. We have baby shower. You have two little ones, right?
Yeah.
We have the baby shower. We get all the equipment. We do all these things to bring them home, but we don't have that same mindset when we're,
Absolutely.
bringing home a senior who's slowing down, when they're moving in with one of their kids. The same attention, the same detail, the same care should be there. Not crisis mode. It's always a crisis mode. And so that's why with this platform, with the podcast, and with the things I put out, I try to help people avert those crises and have the answers.
Yeah, and I mean, that's even one of our missions here at In the Arms of Grace Hospice, is that to give individuals the same dignity and grace in their final days as they had in the prime of their life.
Amen.
And so we do that by really curating this end of life experience for our patients and our families. So yes, I agree with you. The end is very important.
Awesome. So we had that great picture on the hill, before that.
Sun in our eyes. I'm one of the only ones not wearing sunglasses, and I'm squinting in all the photos.
Yeah, and I got my exact steps. It was 12,080 steps.
I told you.
June 12th.
I told you we did more.
Yeah. But everyone, again, we just wanted to come together. Preparations, even though Kevin led us, we had a great training the day before. We had all the printouts of the talking points, just so that we could be succinct. These folks are busy. Their staffers are busy. They have so much to do. They were getting ready for that baseball game.
Oh, yeah. When we walked into one of the congressman's offices, and he was putting on his baseball jersey, getting ready for the game. Yeah. So it was a very busy day. So definitely. But the NHPCO and Han does a fantastic job of really setting us all up for success. And I also feel, it was also the California love. We also tried to do a great job as team leads to try to bring everyone together, because we all have a unique perspective. And I always say advocacy is storytelling. And I love what you said, which is advocacy is education. So advocacy is storytelling, is education through storytelling, to kind of combine both of our words there. And we all have a very unique perspective that we bring to the table. And it was because you were a physician. I'm an administrator, owner, operator. We had another colleague join us who represented more on the technology spectrum of things. And so we all kind of collectively had a very unique perspective through which we delivered all of these messages.
Yeah. We had Sheila. She's the president of CHAPCA.
Yes.
We had Noga. She's a social worker. We had you, we had Brianna McGlory from Guaranteed Hospice, and someone who didn't join the group chat, but we just had a fantastic time. So look out for a reel on Hospice Action Week. I'm sure some of you may have already seen the pictures from NHPCO and Han, and it was just a great time. And to wrap that up, Hospice News Elevate had their conference there, and so we kind of ended the week with that. And so we'll talk more about that later. But it was just a phenomenal time in DC to keep the conversation
For
going
sure.
and helping educate and advocate, because that's what we
Absolutely.
do. So yeah, I mean, I touched on everything I wanted to chat about here. Was there anything you wanted to leave the people with?
No, just that, it's an honor and also a privilege to be able to do what we do, and to be able to represent so many constituents, so many providers across the country, and particularly in our state. It's something that we don't take lightly, and we work really hard to try to put our best foot forward. There's something so inspirational about just walking through these halls and through DC in general, where history has been made, and knowing that you're in some way contributing to it. Sometimes we think our voice might be trivial as citizens. We live in a big country, there's a lot of noise in every direction, and we
Hmm.
forget as citizens what we bring to the table.
Yes.
And when you're in a meeting with a senator or a legislative director, and you see the aha moment in their eyes of like, oh, we hadn't thought about that. And I think even one of the legislative directors for one of the congressmen said, that's why these meetings are so important. That's why we meet with groups like you guys, because you guys are shedding light on things that we have either gone by the wayside or that we have not recognized. And it's the impetus for change. And it's how that action and advocacy is so important, because that's how we move democracy forward.
Yeah. And I think we have a great opportunity as Californians, since we have what I don't know the current figure, someone tried to send it to me, the most hospices than any other state. And so we're not getting into the conversation about bad actors and all that. That's another episode too. But we have the most, so we have a great opportunity to lead the way, as California does in so many other
Yeah.
ways in our country, just to help folks figure out how it is. I'm most excited to see the modernization of the hospice Medicare benefit. And so, as you highlighted during our talks, when it was originally born in 1982, when Judy Lund was there on the stairs, and she's still here with us,
Neil
and she was
Person
there
joined
with
us as
us.
well. Yeah, she was one of the original advocates and the really kind of the founders of this benefit that helped
Yeah,
lead the way.
yeah,
Um,
yeah.
and so, yeah, actually, I'm glad you brought that up, because I did want to touch up on that too, the modernization of the benefit. We don't have any actual legislation in the works right now, but we did bring this up because we think it's such an important kind of conversation to have. And on the onset, when hospice was first developed, hospice started off as a volunteer kind of movement in this country, and even in England and Europe, but more specifically in the United States in the 70s and early 80s. And when it became a Medicare benefit in 82 and 83, um, we were originally caring for cancer patients, for patients with HIV and AIDS, for
AIDS
who
epidemic.
the AIDS epidemic, we're in the middle of the AIDS epidemic, and the trajectory of these patients, the terminal trajectory was not very long. But we've come a long way in the last 30 to 40 years with medical advances. So we patients with these illnesses living longer, but also we see patients with multiple other illnesses, from organ failure, from cardiac illness, from pulmonary issues, neurological issues, and dementia and Alzheimer's. Medical advances have brought us to a place where people might be living with these chronic illnesses for a long time. And yet, once they reach that stage of terminality, prognostication is very difficult. But aside from that, they have an entirely different end. They have an entirely different terminal trajectory. And we need to be mindful of this, and we need to update the benefit to be more inclusive of these various different diagnoses. And you might be saying, great, where are we going to get the funding from? Who's going to pay for all of this? But actually, NHPCO and NAC had done extensive research through the University of Chicago NORC Center, and we compared two different cohorts of similar terminal trajectories, a group in hospice and a similar group not in hospice, not receiving hospice. And the study found that the cohort that received hospice at end of life saved a net savings of $3.5 billion to the Medicare purse. That is huge. That is substantial. And that is because patients with these types of illnesses, left unchecked, are showing up in the ED. They're having extensive hospital stays. They're having extensive treatments that might be of no avail. They are showing up in nursing homes. And all of this costs a lot more when there is this benefit available that does it for far less money, less expensive, and most importantly, in the comfort of the patient's home. Why would we not then expand this benefit to include this cohort? So again, that was a part of really our push to try to think forward, think future, and to modernize this benefit.
Yeah, and for the regular people listening, you're a caregiver, you're thinking about your parents, your aunts, your uncle, your sisters, your brother. I always want to bring it home to the clinical side, to real life. Most people are scared of hospice, scared of the H word. Go back to that episode 1 so you can see why you shouldn't be. But what's important is, let's just use our former president Jimmy Carter as an example, and not him specifically, but just that type of trajectory. Someone in their 90s, slowed down, debilitated. He chose to go on hospice care, and he's on it for over a year, right? Well, the alternative, what I see when people finally crash into hospice, like the last week or so of life, is they've been in the hospital 6 or 7 times, each time getting sicker and sicker. Going to a nursing home, getting a bed sore, maybe coming back home. They're 2 weeks, they fall, they break their hip. Then finally the surgeons say, no, we're not gonna do surgery on that person. And then they finally go home. Why go through all that if there is a terminal condition or something that's chronic, that's at the end stage, and you can use your hospice Medicare benefit? Remember, we talked about it in the Real Deal About Hospice. There's heart disease, pulmonary disease, many things that we see, dementia, that have the end stage when we're outside of the screening age for the breast cancer and all those things. We need to plan ahead for that. And so again, we've already talked about that a ton, and so you guys can go revisit that. But we are really excited about some changes in the pipeline. We can't say everything about it here, but I think the work we did on the Hill is really making a difference for Americans.
And again, just in closing, it's not even just about the financial component. That's kind of a selling point for people who are passing laws, but for everyday Americans, for the politicians, but for everyday Americans, we can do it effectively at home. You don't need to, there's this idea, perhaps you have to be in a hospital for your symptoms. I mean, Dr. G does this every single day, day in and day out, treating patients in the comfort of their home. It could be done effectively. Those symptoms can effectively be managed at home. So just want to point that out there as well.
Yeah. Well, thank you so much for being here and leading. It's always great to have leadership in hospice, the back office, the leadership, that we can rely on, so that we clinicians feel free to do the sacred work of hospice care in the home. So I thank you for what you do for your agency.
I appreciate it.
All right. Well, we're going to close this episode out of Dr. G of the Heart of Healthcare. Peace.
All righty. It's great being with you all. Thank you for the invite.
Take care.